Hello, everyone. I'm Tafadzwa Amani from Kansas City University. I would like to thank you for this opportunity for allowing us to present our research on the epidemiology of diabetic peripheral neuropathy and associated factors in rural Guatemala. Guatemala's data on the diabetes prevalence shows inadequate comprehensive rural data, and this leaves a knowledge gap about diabetic peripheral neuropathy's impact in rural communities. This study aims to estimate diabetic peripheral neuropathy prevalence and associated factors, emphasizing patterns of screening such as food care education and addressing modifiable risk factors. We also hope to provide insights into diabetic peripheral neuropathy, burdens and barriers in rural Guatemala to aid prevent and treat their diabetic peripheral neuropathies and other comorbidities. We also hope to provide a framework for future research to improve diabetes control in low-income communities during medical outreach programs. The study's significance lies in its contribution to the osteopathic medicine by highlighting the importance of holistic approach to patient care, considering lifestyle and social determinants of health in managing diabetic complications. Moreover, its global implications provide a valuable insight into diabetes-related challenges faced by these by underserved populations, and hopefully we'll be able to guide targeted interventions and medical outreach programs to improve healthcare access and outcomes in resource-limited settings worldwide. For our methods, we obtained IRB approval from Kansas City University, and we conducted a cross-sectional study in rural Guatemala in February 2023 during a global health outreach program. A total of 38 participants who provided consent were involved in the study. Those who did not wish to participate received the usual free care. Patients with an established diagnosis of diabetes mellitus, those who were 18 years and above, and those who were not mentally impaired was this inclusion criteria that we used to enroll patients. We screened patients using the diabetes Michigan neuropathy screening instrument, which is a 15-item self-administered question to assess their subjective symptoms of diabetic peripheral neuropathy, as well as a physical exam that examined the bilateral fit of patients. We would look for things like general appearance, skin, calluses, infection, and fissures, and also conducted ankle reflexes and vibratory sensations. The results showed that an overall prevalence of diabetic peripheral neuropathy in patients who are 45 years and above was 81.6%, and it was 7.9% in patients who were 25 to 44, with the lowest in patients who were under 25. So younger patients overall had less diabetic peripheral neuropathy compared to older patients. Then 70% of patients reported mild to moderate severity of subjective symptoms, and likewise 80% were found to have mild to moderate diabetic peripheral neuropathy findings on physical exams. For BMI, patients with a standard to overweight BMI, they had less diabetic peripheral neuropathy than those with an obese BMI. Patients with diabetes mellitus duration under 5 years had less diabetic peripheral neuropathy symptoms than those over 5 years in duration. Regarding the associated comorbidities, such as the hypertension, we noticed that those with hypertension had less diabetic peripheral neuropathy than those who actually didn't have hypertension. Finally, patients who received an annual food exam had less diabetic peripheral neuropathy than those who did not. More than 50% of patients with diabetic peripheral neuropathy had an older age, 45 years and above, higher BMI, and long duration of diabetes mellitus over 5 years. There was a statistical significant association of diabetic neuropathy with advanced age. So in conclusion, rural Guatemala has an 89.5% of diabetic patients with diabetic peripheral neuropathy, and they showed some varying patterns of age, BMI, and duration of diabetes, hypertension, and access to annual diabetic food exams. The findings highlight the urgent need for screening for diabetic peripheral neuropathy in this population. This includes regular screening such as food care education, such that patients can just do the food exam in the comfort of their home if they do not have access to if they don't have access to primary care services. They can also have the education can hopefully help in addressing modifiable associated risk factors that can be cost effective in delaying or preventing further diabetic complications, such as foot ulcers and amputation in resource limited areas. This concludes our presentation. But before I actually conclude, I would like to thank Dr. Desai, Dr. Stewart, and Dr. Tyler for enabling this global health trip for us to do this research. And I would like to acknowledge the Duke International for helping us set up the medical clinics. And above all, I would like to thank the AOA and team for selecting our research to be part of the presentation during this conference. Thank you so much, and have a great day.